I am Dr. Jay Hitson, and I am excited to talk to you today. I'm the founder of GoodDoctors.Health. And one of the big things that we really zero in on is root cause, getting to the root cause of your issues. Now, I know that to some of you that may sound like, well, obviously that's what we want to be doing, but just to understand that that's not really the standard of care today in modern traditional healthcare. In general, it's a lot of just masking and managing conditions, not understanding, where it's coming from, dealing with the root cause, or even addressing it, and very rarely really talking about how to reverse, especially if you're talking about chronic disease. These are just not parts of the traditional standard of care. So much of what healthcare now is simply, using a lot of pharmaceuticals and all of these different prescriptions just to cover up what's going on. So when we're talking about root cause, first of all, let's just get into why do you want to look at the root cause? For those of you who are newer to this concept, or not even aware that this is an issue in healthcare. The reason we want to get to the root cause is because then it is so much easier to solve the problem. So if you don't know what caused it, even if you can manage those symptoms, even if you can kind of get things under control, well, it's going to keep happening if you haven't eliminated where it's coming from. So this is where, people talk about, like, for instance, if you're getting exposed to mold, well, you can deal with all of the scratchy throat and the watering eyes and the itching, and you can, yeah, of course, you can manage all of those symptoms. But if you don't address the root, the mold issue, well, it's just going to keep happening. And here's the thing: is that means even if, again, you're managing all the symptoms, this is going to get progressively worse because your body is going to get fatigued. It's going to get tired of consistently, dealing with the drain of, of what's happening. And furthermore, this gets really, really expensive when you keep dealing with the same problems over and over and over again. That's why we want to be looking at root cause. So, one of the things that I'm looking at when we're trying to understand, like, okay, first of all you have to even care to be in the health system that is root cause focused, which again a lot of traditional healthcare is not. Secondly, and okay, now how do we find it? How do you get to the root cause? And here, what I want to do today is give you a lot of the things you want to be looking for and focusing in on. So maybe you can figure it out yourself, but even if you are going to go see a physician or you're working with me, you can really help those practitioners, those providers in the discovery process. So first and foremost, you want to know, when did this start? That really helps us to understand. So if this is a problem that's been going on, 10 days or 10 years, we want to work backwards on timelines. This is really important, okay? Because then we can kind of look at what was happening during that time frame, what has been consistently happening during that time frame. We can dive deeper into it, and it gives us just a better understanding of what was happening and what could have happened that has led to this. So time. The second thing is, during this time, has it been staying the same? Is it getting better? Is it getting worse? Okay. That's going to let us know also more about what kind of disease process or what kind of trigger, what are we dealing with. So if the problem is getting better on its own, then there's a very high likelihood that the initial exposure has gone away. Okay, that helps us really understand. And now we just need to work backwards from that. If the problem is getting worse, well, that means that either the exposure has gotten worse, or it's at very bare minimum probably still present. So that's very, very significant to understanding what is going on with you and how do we break it down. And I want to be very clear. I work with a lot of individuals who have very mysterious health conditions. I work with a lot of the people who they've been from physician to physician. They've been everywhere, and they still can't find answers to the problems that they're dealing with. So that's where, people who, are trained the way I am to do more diagnostic, more deep dive, that's where this becomes so significant. And again, the more individuals have really thought about it and have, are aware of these factors, the easier it is to help. So, same, better, worse. Now, another really important thing, most individuals who are trying to get better, they're trying to get healthier, they're trying to do things. You really want to know what you've tried and how did it change things? Did it make it better? Did it make any difference? And can I encourage those of you who, okay, you're really on a health journey and you want to get to the root of, okay, I have no energy. I have no energy and I need help here. Okay, as you're trying some of these different things, don't do everything all at once. Kind of clouds it so you don't know if it did help, but you don't know what was making the difference. Try to do one thing at a time, you know, like for instance with energy. Okay, try exercise. Do exercise and give exercise, a solid 7, 10 days, a few weeks. Give that a full go before then you go and try another supplement powder. The issue that I run into with when we're going through this process with some people is that they're throwing the kitchen sink at the problems, and we're having a really hard time like pulling apart what is really going on because you're just throwing too many things at it all at once. So just being a bit more controlled and a little bit more deliberate about the things that you're trying. So, again, let's talk about energy because so many people struggle with fatigue and just they're just feeling so blah and all of that. That once you've tried one thing and then write it down. So if you tried exercise, write down what you were doing, keep a log because I know this sounds really funny, but you're not going to remember. You don't remember all of these different things, especially if this is going over a course of months and, sometimes a lot longer than that. Um, Now, one of the next things as you're going through, okay, how did it change? But really do note if you tried something and it made things worse, write that down. That's significant, okay? Because here's things that make it worse. Well, that tells us that really does tell us a lot about root cause. Like I'll give you for instance. So sugar is very inflammatory. And so some people, whenever they are, they're dealing with a lot of inflammation, they'll go on like a sugar cleanse. They won't eat any sugar for a period of time. And most of the time, that's going to really help a lot of individuals who are dealing with inflammation. But for instance, if somebody like goes on like a sugar fast or they go do any kind of fast and their symptoms get worse, oh, that really tells me a lot about, okay, well, if it's not that, if that makes it worse, then we need to go this direction. A lot of there's just so many factors like that. Individuals who, like they say, I started taking magnesium and my problems got worse. That tells us so much. I know we don't ever want to get worse, but let me just tell you that tells us so much about what the real problems are. And let me just tell you, this isn't a fast process of going through, even when you're working with, a very experienced practitioner. You have to kind of keep digging to keep digging to keep digging. That's why I like to do videos like this. So those of you who are working with me, you can be or you're planning on working with me, you can start putting together your log so that the conversations go so fast and so quick and so effective. Um, and you can really really get the answers that you're looking for. And I'm going to tell you, I mean, if the issues that you're dealing with are straightforward, there's really just one root cause, you're not going to have too hard of a time figuring out using AI nowadays. um, if there's just one thing that's causing your problems, for the most part, a lot of different searches, you're going to be able to land on some really awesome things. The issues that I'm running into for a lot of people is that if you have a multifactorial problem, so it's not just, let's say, an exposure to an allergen, but you're also dealing maybe with some autoimmune factors. Well, see that override is is where a lot of that's where it gets really confusing. And again, we end up still needing human support to navigate through and just using a lot of experience to figure out what's going on there. So as you're going through, what makes it better, what makes it worse, being very clear on what you have tried, um, and just being aware. You don't have to try everything, but just being aware of what you have and what you have not done. All of these things really help narrow us down to the true root cause. Now, again, and just to recap, the reason why I am so root cause focused and why I'm going there is because if you don't address the root cause, you're going to keep having a problem. This is going to keep being an issue over and over and over again. And over the course of months and years and decades, this puts an incredible strain on your system. So we want to understand where that is coming from. So for those of you who want more information about this, like, subscribe, please tune in so that we can help you get access to the information that you need. And whether you work with me or other practitioners or try to do this all on your own, you just need some of the simple guidance through the system because this isn't how traditional healthcare works. This is not what most people are used to when you are going through and trying to get answers for your health. And that's what's so important. So I hope this helped. Please, if there's anything we can do, put it in the comments. We'll be happy to help. Have a great rest of your day.